So our agenda today will be doing our welcome, which I just did, and I'm going to be introducing our guest speaker, Miss Patricia Dixon. We'll be having our Q&A session and then the closing. So, welcoming y'all today on our webinar. I'm introducing Miss Patricia Dixon. She is Navajo, Hickory Apache, Santa Clara Pueblo. Patricia is a single mother to 4 wonderful children and has 1 daughter with special needs. She has been a registered dental hygienist in Arizona for the past 7 years and received her associate's in applied science degree in dental hygiene from San Juan College in Farmington, New Mexico, the class of 2015, and later received her bachelor's of science degree in dental hygiene from the University of New Mexico from the class of 2020, and currently she's a pre-dental student on track to apply for dental school in 2025. Patricia's passion is dentistry, and it is to educate her patients in prevention on oral hygiene, and believes that oral hygiene starts at home and can be part of one's everyday routine. She states that teaching our children the importance of brushing and flossing daily will help increase the prevalence of dental decay and disease. And she's very glad to meet with everyone and sharing her experiences and tips to help create good oral hygiene and routines to be used at home. So now let's turn our attention to Ms. Patricia Dixon. She's going to be sharing her slides with us today. And just remember to, if you have any questions, please feel free to.
Okay, sorry. I don't know if it was on your end or my end, but you were freezing up there for a minute. Okay. Thank you for that introduction, Dawn. I appreciate it. And again, my name is Patricia Dixon. I am a registered dental hygienist. I do practice here in Phoenix, Arizona. And in honor of the February Child Oral Health Awareness Month, I was asked to do a webinar with you all today. So I couldn't pass it up with Dawn because she also, I worked side by side with her before as far as our pre-dental events that we've met at and have both attended, sorry. So I'm going to go ahead and get started. So keeping your child's teeth healthy is very important. Just a little bit of definition of what the early childhood caries is. So according to the American Academy of Pediatrics, early childhood caries as tooth decay in any primary tooth in a child younger than 6 years. Also refers early childhood tooth decay or also baby bottle tooth decay. Early childhood caries involves the transmission of infectious bacteria. It also includes dietary habits and oral hygiene as well. ECC, also known as early childhood caries, is an infectious disease with Streptococcus mutans being mostly commonly recognized organism, which is found in plaque. The causative triad for caries includes cariogenic bacteria, fermentable carbohydrates in the foods that we have, or even the drinks that we have, and the susceptibility of the host, which is, the patient or the child, and the integrity of the enamel. Caries has also been described the most prevalent pediatric infectious disease and the most common chronic disease in children. A little bit of epidemiology. I'm not going to go too much into detail. I just thought maybe this would be important for not only us as parents to know why oral health at home is very important, as well as getting our children to see our dentist every 6 months. So according to the American Academy of Pediatrics on Native American Child Health, they had a report here that shows in 2011 the prevalence of early childhood caries from ages 3 to 5 was about 80%. And secondary early childhood caries was as high as 25%. So, and then in 2014, IHS also showed that 75% of those children, American Indian, American Native children between the ages of 3 and 5 had early childhood caries in many of the communities. So this is a rate that was above 90%, which is 5 times greater than the general US population.
Patricia, I'm
Yes.
sorry to interrupt you.
Yeah.
We're not seeing your slides.
Oh, I'm sorry. I hit share, right?
Yes, share screen.
Okay. Oh, goodness. I apologize, everybody. This is actually my first webinar. So I'm having a little technical difficulties. I see the share box, the red box on top, the upper right. That's the one I hit, right? Dawn, are you there?
Look on the very bottom, there should be a green box that says share screen.
Okay. I don't see it. Do you want to just go ahead and share off from your end?
Yes, let me go ahead and bring
Okay.
those up for you.
Sorry, guys.
You're doing great. We'll get these situated, and we apologize for the
Oh,
delay,
goodness.
everyone.
Yeah. Rookie mistakes.
Sorry for the technical difficulties. We will get these up here in just a second. Okay, if someone can put in the chat if you can see that slide.
Perfect.
Patricia, can
Thank
see the
you.
slide?
Yes.
Okay, great. Is this what page you need to be on?
Yes. As I was just
Okay.
going through the epidemiology of the early childhood caries. So the true burden of ECC in Indigenous children is not only the EC prevalence, but also disease severity. The average number of decayed or filled teeth in American Native, American Indian, Alaska Native children 2 to 5 years old was 5.8, almost 5 times that of a general preschool population. So this kind of gives you an idea of the severity and the prevalence of early childhood caries within our population, and the importance of oral health education as well. Next. This is just a little diagram that I included with this epidemiology that I found as well. These are some of our risk assessment tools. This will be more for providers. And also, I think it's helpful for parents to see this as well, to see how we determine and determine the degree of early childhood caries prevalence, and also how we modify treatment for each individual child. So you can see on the left side, the caries risk assessment tool. There's different companies. There's 4 right there. So CAT, there's Canberra, there's American Dental Association, and there's Karyogram. So protective factors is mainly on all 4 of them. Looks like fluoride exposure, which includes daily dental care, which is fluoride in your toothpaste. The risk is, mother to caregiver. This is why we always encourage new moms to not share utensils or you drop the pacifier, put it back in the baby's mouth, that's another way to transmit bacteria into the baby. Another one is frequent snacking. We're snacking all day. And it's usually fermentable carbohydrates like chips and crackers. And then also goes into eligibility for government programs. Insurance does have a factor in how we render care, and also prevention. And then special needs healthcare is also another factor to look into, and then dietary as well. Um, you can go to the next one. So that's just for information if you guys want to look at that. Wow, that didn't save. The keys to oral health prevention is brushing twice a day, morning and also at night before you go to bed for 2 minutes, flossing daily as well, a low sugar nutritious diet, and also visiting your dentist or dental clinic every 6 months. You can go to the next one. So these next couple slides kind of show age-appropriate types of tools that you can use at home, when to introduce them. And again, everyone's going to it won't work for everybody, but you can also modify these products as well to your needs at home. So from ages 0 to 3, this is from birth when children are being breastfed. It is shown that the milk can stay on the gums, so, I think after every feeding, wiping baby's gums with a washcloth, a wet washcloth is recommended, and then, of course, they have other products on the market that do, promote gum health as well, which are the Dr. Brown's, gum wipes there, and when the baby has a budding tooth or a first baby tooth that's erupting, they do have those little silicone finger brushes that you can use to start stimulating, kind of getting the baby used to you doing the oral health routine, getting them to laying down. And so just trying to get the baby adapted, and also a routine down every day. You can also start the baby with a baby-sized toothbrush with a small head there. And I think more towards age 2 and 3, you can start doing the right-sized toothpaste. You actually can probably use the non-fluoridated ones, just to kind of get them used to the whole idea of having, the toothpaste and toothbrush in their mouth. Can you go back really quick, Dawn? Thank you. And then also, you can possibly introduce handheld flossers. I know the baby's gums are still they're still maturing, teeth are still erupting, but I mean, I think just going through the motions of actually feeling the little string in between their teeth is helpful as well. Next. So ages 3 to 5, it is recommended kids-sized soft toothbrush with a small head. You can kind of introduce the battery-powered toothbrush or electric toothbrush at this age. Still a little too young, but I mean, it's totally whatever the parent deems appropriate. And also, I have a little picture there showing the difference between the right size toothpaste and also the pea size. So that way we kind of have an idea of how much toothpaste to use. And then also handheld flossers, maybe more at the stage, because the dentition is more, it's not together, it's more spread apart. But still, we have gum tissue that's surrounding the teeth. So we still want to get in there and stimulate the gums, clean the plaque below the gum line, and also get the children used to the routine. That way, in the future, we're trying to set the children up so when they go to a dentist, they're not going to fight. They know what to expect, and they're more accepting of the dentist or that dental hygienist to do the work. And then also, this would be maybe a good idea to introduce string floss as well. Have the child lay down on your lap, um, and then also um, have the child lay on your lap, kind of like while they're watching TV, or holding their favorite stuffed toy or blanket, and then just kind of go through the motions and get them used to the idea of string flossing as well and lying down. You can go to the next one, Dawn. Thank you. This next stage is ages 6 to 9. I the kid-sized soft toothbrush, still a small head, and again, like I said, some children might develop faster than other children and might progress to an adult toothbrush. So it's totally whatever the dentist or clinical professional and parent thinks is appropriate for their child. So always soft toothbrush. This is where you can start using the more powered battery electric toothbrush as well. Right side, this would be actually the pea-sized toothpaste. It would be the appropriate amount here. String floss, this one week, as a hygienist, I try and sit with my patients to hold a mirror, and I'll show them, arm lengths of floss. Just pull out the little spiel, use your middle fingers and your pinchers, and then kind of wrap it around the tooth. And I kind of show them the motions of what they need to do. And then, then I'll give it to them and kind of see how they do, and kind of, modify areas that they need to work on. And again, this is kind of just a learning stage too. So, and parents are still encouraged to help children at this age with brushing, because we're not always getting the back. Children are always in a rush to get up and go to school, or are playing video games late at night and don't want to brush. So just a lot of encouragement, and then just kind of going back through to make sure that they've accessed those back teeth, especially, and then flossing as well. Next one. So this one's a little bit older, 10 plus. By this age, and again, everyone's different, but uh, children at this age should be able to use string floss every day. If not, the handheld flossers is still an encouragement. I personally think that anything is better than nothing. And if they have any um, challenges of how to do certain things, I mean, kids nowadays, there's YouTube videos, the age appropriate ones, that can show children how to brush and floss as well. This one, electric toothbrushes, I think they're more efficient at cleaning. You're less heavy-handed and, injuring the soft gum tissue. And then also, I think regular fluoride toothpaste is age appropriate for 10 and plus as well. And then there's a lot of mouthwashes out on the market. And again, these products are just for the education. I'm not I don't promote any of these products. It's just for pictures. They kind of give you a visual, because I'm a visual learner. But there are a lot of mouthwashes out there that do have fluoride in it. It helps to coat the teeth. And then also, there is another ingredient called xylitol, which is a natural sugar that you can find like in Tom's toothpaste. And, this is found like Sprouts or any natural grocery food store. We can go to the next one, Dawn. So just a real quick wrap, if you want to have an idea of what stages of toothbrushes children need to move in, I just kind of added this in there as well, a little timeline for the children there. You can go to the next one. So brushing technique, we always encourage, a soft bristle toothbrush. It doesn't really necessarily need to be a fancy, name brand one, as long as it's soft. Um, we encourage using and placing the toothbrush there at a 45-degree angle. Um, we can tell you all day 45 degrees, but some of us don't really know what 45 degrees looks like. So I was like, I better put that in there. So that gives you an idea of what 45 degrees looks like. So it's touching the teeth and it's also touching your gums at the same time. And you also want to do very soft circular motions while you're brushing along all the teeth there. Going back and forth is going to injure the gum tissue and it also can cause what we call this recession of the teeth. But, you know, um, an electric toothbrush is also encouraged as well, which will be less damaging to the gums. But I feel like it just cleans a little bit more than the manual brushing, but either one works as long as you're brushing in the morning and at night for 2 minutes. Next slide, please, Dawn. The next one, this is my daughter. Her name's Mai. She was born with Down syndrome. So she agreed to be my little helper. So I took some pictures of some techniques that I use at home with her because I think she's more stubborn than my other children as far as when it comes to oral health care or just anything in general, just because sensory and also um, she just doesn't like anyone touching any on her face. So, the first picture on top there, I just kinda gently pull her lip up there, but you wanna be very careful not to pull that little tissue there, it's called a frenum. So I just lightly push up, and then that way it exposes all the top teeth, because that's the area that we miss the most when we're trying to brush our children's teeth as well. So that gives you a better visualization of, how where you're at with the toothbrush. The one on the bottom, same thing, got the little tissue attachment on the bottom, so you wanna be very careful when you're pulling the bottom teeth. And you can see how her teeth are spread apart. She is 4, gonna be 5 years old, so it kinda gives you an idea of dentition. But and then on the bottom picture there, I use a no pull finger technique. So I will put my finger in her cheek pocket here to rest it and just slightly retract like this a little bit, not like outward. And I just have her bite down because when she's opening and this is for my experience when she was wide open and I was trying to brush her teeth on top and bottom on the back, it was hitting the back of her gums there and her cheek. So I know she didn't like that. So I told her to bite down. This is a lot better visually for me and then also for her as well. And when she opens, then I'm able to access, the chewing surfaces of her teeth and get those cleaned as well. And then you can move to the next slide, Dawn. Just some flossing techniques for you guys. Like I said, the arm lengths of floss. This is for string floss. And I think this is a great picture. I've always been wanting to take pictures on my own, but I found this is wonderful because parents don't really know. And when I have parents accompany their children while I'm cleaning their teeth, I always involve them because some parents don't even know, and some just don't have that. Never were exposed to the education, so I get a lot of like, "Wow, I didn't know that." So anyhow, so you wanna get like arm lengths of floss. You wanna wrap, both the middle fingers again, and I call them pinchers just 'cause, kids can relate to that a little bit more. Put the use your pinchers, and then, like the picture they're showing, you go through the contact of the teeth there, not so hard where, you're using a lot of pressure and you cut the gums. You wanna just gently go through. And then once you get through, you wanna wrap the floss like in picture 2 there, that's called a C shape, where it's, wrapped snugly around the tooth there. And then it slides underneath the gums a little bit. I would not use a lot of pressure, just get to where it's kind of blanched a little bit. And then, I call it bouncing up and down because 'cause you're kinda using, you're pulling the floss against the tooth, and then you're kinda, like, bouncing it up and down a couple times, and 3 times is optimal, and then you can pull back through the contact, and then you see the plaque or the food that comes out, and you can show your child or patient and be like, see, this is what we're removing. And then you can continue your education from there of why it's important to floss every day, or have mom and dad help to floss so they can be like, oh, okay, I see that. And then just kind of repeat for the whole mouth. And eventually, this is something that we definitely would want to be a part of our children's everyday home care, so that way they can take it into adulthood and also pass it on to their children as well. Next slide. This is the flossers with the plastic handle. These are a little bit easier for, I believe, from maybe 3 to, give or take, maybe like 6 or 7, just totally up to the parents and the caregivers and providers what the suggestion is. But to me, the plastic handle has different colors. They're more geared toward children with different shapes and fun flavors sometimes. So they're more accepting of wanting to do the flossing with the plastic handled ones. So I just give an example at the bottom. I'm flossing my daughter's teeth. Even though the teeth are not touching, like I said earlier, it's important to get the floss in there, remove the plaque and the food, and then also kind of get them used to the idea of you doing this every day. And then also, the one on the bottom, it shows the 2 front teeth. That's the main area where I've seen children get caries, because that's where they're drinking out of a sippy cup, water, or not, anything that's they're consuming that's going to hit that area first. So it's really important to get in between that area, and you can use that modified lip pull right there, and that way you can get in there and remove that plaque before it turns into a cavity. So, and the next one, Don. So another thing is it's important to visit your dentist every 6 months, or your dental clinic. I know there's probably a lot of factors that prevent this from happening, and I think, like I said, I think learning at home care is very important, especially if you're not able to see a dentist for at least 6 months. This is just a little chart here to show the stages of development and reasons why, at the beginning stages of childhood, it's very important to see a dentist, especially when the baby's teeth first develop. And then ages 5 to 7, that's when the mixed dentition comes in, and then also um, possible evaluation for other extra care, which would be like orthodontics. And then age 12 to 14, this is where we're teenagers. And this is where we monitor mostly wisdom teeth and also orthodontia. And then let's see, the children will usually last their 20. Okay, you can move to the next one. Sorry. Okay, and then fluoride applications, very important as well. You can get natural fluoride through your water system. I know there's a lot of uh, I don't know how to say it, but I know a lot of people are against fluoride, and there's a lot of fluoride gets a bad rap. I'll just say that. But I think natural fluoride in your water, it's monitored by the city, so there is a safe amount. If there is no fluoridation in the water, seeing your dentist every 6 months is very important, because they can do fluoride applications like the varnish here. There are other fluoride treatments that come in like a foam form, where they put the tray in the mouth. And then also, there is a safe amount of fluoride in your toothpaste that you can use every day, and mouthwash. So those exposures to the teeth is really important. Helps to remineralize your tooth enamel. It can reverse early tooth decay. And then it decreases the bacteria in the mouth, and then also just helps to strengthen the enamel. Next one, Don. So there are some myths. I thought this would be a fun little thing to add in here that and I've actually heard some of these. So the first one is there's no real difference between a regular dentist and a pediatric dentist, and that's true. It's just a pediatric dentist are specially trained to provide oral health care from birth to adolescence and use special behavior guidelines and techniques to make children more comfortable. They're the pediatrician's dentistry. So if you go to a general dentist or just a regular clinic, it's fine. As the dentist there knows what to do if they need to see a special pediatric dentist because of maybe behavioral issues or the patient has a lot of rampant caries and just need that extra special attention, then that's when the patient will get referred out to. And there are also pediatricians that have their own private practice and they are geared towards children. So they have fun games and just the whole atmosphere of the office is geared towards children. So I think just seeing a dentist in general every 6 months is very important. The other one is I don't need to take my child to the dentist until they're at least 3 or 4 years old. And again, this is totally based on provider. Always listen to your dentist and the recommendations. But the fact is, to prevent dental problems, your child should see a pediatric dentist established or a regular dentist. But to establish a dental home within the first tooth appears or no later than his or her first birthday, just so we know that that tooth is erupting well. There's no carious lesions on the tooth because you know, baby teeth can also affect permanent teeth. So, and then also just getting the child used to seeing a dentist that very young in age. And the third one is baby teeth are just going to fall out. Anyways, they don't really matter. Yes, they do. Baby teeth matter just as much as adult teeth and are indicators of what the adult teeth will look like. Good dental habits are something you want to make a regular part of your child's life from the early stages. So that will help decrease the prevalence of early child caries as well. Next slide, Don. I didn't go too much into detail with special needs. I kind of just did a little bit of top pointers, I guess you would say, feedback. Just because my daughter does have special needs. But if you guys have any other questions about what I do with my daughter or, things that have helped me, feel free to ask after. Um, and I'll do the best I can to share my experiences with you as well. And then next slide, Don. So my thing is, we have to modify stages of age-targeted products. So we can say this is only for 0 to 3, ages 0 to 3, but a child with special needs might need still like a baby toothbrush. So you just kind of modify the products that are available out on the market to your specific needs and your child's specific needs as well. I find toothbrushes and floss holders with extended or wide handles are a lot better, not only for the parent, but also the patient if they are able to try and practice. It's the grasp is a lot better and it's more stable. The child does have his grasping issues, like holding a regular toothbrush. There are tricks as well, like you could put a little tennis ball at the end of it so they can hold a toothbrush. You could do like a foam grip where it models to the child's hand so that it grips the toothbrush a little bit better. And I've heard the rubber bike handle, not a huge handle. You just kind of put it on the end of the toothbrush so that way they have a little bit more control with the toothbrush as well. Another thing you could do is invest in a power electric toothbrush. It depends as well. It could provide stimulation for those with a hyposensitivity. My daughter still does not like the sound of it, but she is willing to try maybe like two or three teeth to this day. I've tried and started using the battery powered toothbrush about 2 years ago, and she hated it. She did not like the sound. She didn't like the way it felt, but slowly in increments, I would try to work my way to where she is hopefully using the power toothbrush a little bit more, but still um I think patience is key, and then just kind of working in little stages so they adapt to it a little bit better. Water flossers are another thing. And again, this would be something that you think would be appropriate for your child. Some um, children, may aspirate water, so this is probably not a good idea for those children. But I know my daughter went through orthodontics and she loved it, and it worked very well with her. Um, the another one is three-sided toothbrushes. This is the one that has, well, there's a top, there's and two sides of a toothbrush. So it basically covers the whole arch of the teeth. So that's another idea you can try. I haven't tried that yet. There are pre-pasted toothbrushes as well. It's kind of dry. You just put a little bit of water on there, but it doesn't foam as much as regular toothpaste does, because sometimes that can be a little too much for a child with special needs as well. Mouth props. This I don't. I think maybe in a dental setting, this would be okay with using mouth props. Um, don't have experience with the mouth props, but, if you do, please let me know, and it just sounds like, um, I just like I said, I just use my hand with my daughter. Mouth props, I think she'd be more upset if I were to put one in her mouth. And then providers and, I think it's important for dentists and dental hygienists because we are probably the ones that see the patients most every 6 months and give, a education based on oral health. They have the, tell, show, do for patients. So you're gonna tell the patient what you're doing today or what you're doing at that moment, show them what you're using and how it works, and then do the action for them so that way you're informing them of what you're doing before, instead of just jumping in there, and then they might be a little bit more hesitant and be like, what are you doing? So I this really helps, I think, more for younger children. um, and then also it helps with the parent as well. Like I said earlier, including parents with the education of oral health is very important because, most of us don't know what to do or the proper way to do things. Parents are very appreciative when I actually sit there and include them with the education and oral health instruction as well. Next slide, Don. So these are just pictures of a couple of products. Like I said, I'm a visual learner. So the picture with the yellow background that shows a little bit of how you can modify the handle for children. Um, it's a little bit wider. It's kind of a rounded handle as well. The flosser on top there, it's a wide handle as well. And this one you could feed through in that flosser. And again, you just kind of have to experiment and see what works and doesn't work for your children. That's the water flosser on the right side. And again, might not work for everybody, but it's not a bad idea. And then there's so many electric toothbrushes on the market. Um, I always get asked which one's the best, and I just tell patients, um, I think anything battery powered, electric powered works great. It just depends on what they want. Sonicare there's toothbrushes that go up and down a lot. And then also there's the toothbrush with the round spin brush. So it just depends on what you think is going to work better. I personally like the spin brush for my two young children. I just feel like it's not as strong as the up and down action, but again, that's through my experience. Go ahead and go to the next one, Don. So my final tips and takes away are brush in the morning and before bedtime for 2 minutes each time. Always use a soft toothbrush, rice or pea-sized toothpaste. And again, this is based on the child's age. Uh, do daily flossing, of course, with the parent's help until maybe about 10 years old. String floss or plastic flossers are available. Always a nutritious, low sugar diet. And then visit to the dentist, dental clinic every 6 months is important. Where, it depends on the age of the child to do x-rays, or, if there appears to be a lot of clinical caries, and they might want to take x-rays, an exam every 6 months. Prophy, sorry, that to me is a hygiene term for cleaning pretty much. And then fluoride applications based on the child's age as well. So there's like the varnish and the foams. Next one. Can you copy that link and then play it? I put a video on here. You guys probably have seen this video. It's the Native American Tooth Fairy. She wraps everything up that I've talked about today in her video. It's a short, like 3-4 minute video. I really want you guys to see it. Are we able to play that copy and put it in the
Give me just a second. Let me see
Okay,
if I can
thank
get
you
it to
so much.
play. I apologize, everyone, with all the technical
Yes, thank
issues
you for being
today.
so patient with me. Like I said, this is my first webinar, so if I say, a lot, I apologize. While she's getting that together, I'm just gonna look in our little message box here. Okay, I see question about the slides. Yes, we see them. Yay. Yes, questions at the end. Tooth.com is a Native woman-owned business. Oh, I have to look into that. Thank you so much, Brian. Yeah.
Patricia, the video is saying it's not available anymore.
Oh, really? Okay. Um, darn. Okay. Well, if you guys want to watch that video, it's a really good one. I thought I had pasted it there so I could just click on it and play it. Can you click on the link? Does it show it on the white part of it? Because sometimes it'll just pop up on its own.
Yeah, it's not clicking on.
Okay, that's
Let me
fine.
try.
Okay.
I can try it one more time. Give me just a second. Let me try.
Okay. If it doesn't play, that's fine. I
Yeah.
think we're good for it today. All right. Well, you can go to that link. I have it in my resources page, which is at the very end. So you can copy and put it in YouTube. And it's a really cute video. She just goes over oral health instructions, why it's important. And then also, oh, it's not even there. I don't know why my stuff's not showing up for you. Well, I did email you my PowerPoint. I think some people on here, I think I just saw are asking for
Yes,
it.
definitely. You can email me the slides and then we
Yeah.
can, yeah, and we, whoever asked for it, but we
Okay.
can definitely send those out for you all.
Okay.
Thank you, Patricia. And we're gonna go ahead and move to our question and answer section. So give me just a second and we will have everybody. If you have a question in the chat, please put it on there. Or raise your hand and we can see. Actually, it looks like we have someone, Ellen Bune. Do you have a question? Ellen, if you have a question, can you put in the chat if you can't see anything? Okay, you have your hand up on the screen. That's why we were asking. We have any other questions that for Patricia or myself that would like to ask? We are more than happy to answer your questions. Email me the PowerPoint, please. Yes, Eugenia. Put your email in the chat and then we can email you. Thank you, Eugenia, and we'll email you. Just put your email in the chat and we will email you that. And we also have Brian Hudson asked, what are your thoughts on interdental picks? And I'm assuming this is for you, Patricia.
Yes. I like them. I know there's a lot of different products out there. I personally like the interdental picks that is made of plastic on the inside and then silicone on the outside, because for me, I feel like it's less going to be less abrasive to the enamel and causing wear to it. Because some of us will try and put in spaces that's a little too tight. The ones with the bristled brushes, they do have different levels of the diameter. There's tight ones, there's wide, some for wide open contacts. So definitely I love them. I just always tell my patients to be careful when using them. And then what type of us professionals would call them embrasures to use them in as well. Especially my aldo patients, they have a lot of like crowns and open spaces, missing teeth. I think the interdent brushes are a great another alternative way to get plaque and food out from in between the teeth, as well as flossing too as well. And of course, give them a mirror and just show them what to do, and then what to do and not to do, so that way they don't cause any more damage to the enamel.
Thank you for that. Looks like I'm going through the chat. Yes, everyone, you will get a copy of the webinar. I will post the recording of today's webinar. We should be having that sometimes next week. Again, please put your email in the chat, and then that way I will email you the link to the webinar and you'll get a recording of the webinar as well. And also we can send, if Patricia would like, she can send her slides too as well. Ryan Martin asked, Patricia, what organization are you working with? And are you engaged in local Phoenix area Indigenous dental primary intervention?
I don't currently work for an organization. I'm actually a pre-dental student, and I'm just a temp dental hygienist that's going around to all these offices in Phoenix and working. I do have over 10 years of dental experience. I would like to get more involved in our Indigenous community and dental events as well. So like I said, when Dawn asked me to do this, I said, I have to do it. This is my way of getting my foot in the door and getting more experience, and also exposure to hopefully work more with our Indigenous communities as well.
Thank you for that.
Mhm.
And Brian Hudson also said, if anybody in a webinar would like a free tooth sample, and that's TOOF sample pack, email him. And if you look in the chat, he has his email in that, and getting in touch with you on more possibly future projects.
Yes.
Let's see. And looks like we have someone named Robert said you did great and very informative. Lily said you're doing a great job and proud of you. It looks great.
That's my mom. She works for
Brian,
Northern Navajo Medical Center.
oh, awesome. I'm so glad she got
Yeah,
to
she
join
does.
us.
She rock. Yes.
Also, Brian Hudson said the CEO is also an RDH and co-developed the design
I know, I'm excited. I have to get on that link and
Kinds of the
see.
brushes. And Brian, you did say that. Yeah, I really appreciate all these questions and comments.
And like I said, if you guys have any other products you like to send me links, I can do more research on it, or maybe do another webinar with these products. I'm open to anything right now. So, and I would love to maybe possibly try some of these products on my own patients as well.
And Ryan Martin said, awesome, Patricia. Thank you for your work. And someone mentioned, Ryan, I would like a tooth, please. That was from Tracy. I'm assuming toothbrush. And then she also said, the great presentation, Patricia. Thank you. Ryan Martin is requesting for you, Patricia, to put your email in the chat.
Okay.
So that way they'll have that. And Sheena, I believe, yes, we'll definitely send those. And like I said, I have your email here, so we can send you the link and the slides for you for the presentation.
I just put my email in the chat.
Yes, Alyssa, that answers your question. If we wanted a presentation, are you available for that?
Oh, yes.
So email Patricia, she'll let you know.
Yes.
Someone asked, Olga asked, what is the best route to coordinate care for children that have native health benefits?
The best route in my experience, because I work with Dr. Hossie, she is the dentist over at Phoenix Indian Medical Center. So I worked very closely with her with the Give Kids a Smile Day. I know they do health fairs at the PIMC more than once a year. I'm going to say maybe every quarter. If you can get out there or even to a health fair in your community that has dental, they're going to have valuable information for you, because we give out handouts that have telephone numbers of all the dental clinics across Arizona for all the people there. So if they're trying to say you're from Salt River, or you're from Yuma and you're trying to get to a clinic there, we have a phone number there. That's one way we can give you resources to get more information, or possibly I know PIMC doesn't really do appointments. And then also they have steps of how to get into PIMC. From my knowledge, I know that they'll see children up to a certain age, they'll do appointments for recare. But as far as more of adults, you have to be there, like I heard, like 4 o'clock in the morning in front of the door. And then they take so many patients per day in the morning. So my best guess would be to call your local dental clinic and get more information. I know sometimes the communication can be a little bit more of a obstacle than anything, but don't give up. And then also, again, health fairs are going to be really a valuable asset, because you're actually talking to the clinic employees there as well, and they'll give you a little bit more lead and feedback too.
Thank you for that. Yes, Olga also said that we screen children in the community in the East Valley through First Things, First Dignity Health. Some do not have transportation to Phoenix, so that's probably where she came up with the question.
I know outside of everything else, as a parent, I did get WIC when my children were growing up, because I was a dental hygiene student and also a pre-dental student. So WIC, if you have WIC, they do have dental clinic screening days there. They have actual hygienists that are at the WIC offices that will do dental screenings. They will do fluoride applications. They give out free bags of your toothbrush, toothpaste, floss. They give out handouts for proper nutrition, of course, and then oral health for the parents, and other resources. They're there available. So reach out to some of your community government type, programs, because I know nowadays that we're doing the best we can to help promote more oral health, especially for children and those with the the hardships of not being able to get to certain places and also afford the insurance to cover dental care. I know I'm still trying to find other resources for my patients that I see in private practice because some of their family members are in that in I don't want to say group, but just to kind of give them leadway of try and be a point of source. Sorry, I'm trying to get my words across. Trying to be a point of source of how else to get dental care as well.
Thank you for that information. And she said, thank you. I will reach out to the clinics in WIC to see where they are sending children with these benefits.
Yeah, another thing is I know Navajo Nation, they have Head Start clinics. So their IHS is contracted with some of the schools on the reservations and they'll have I know they used to have the ceiling trucks. I don't know if they still have that, but they'll have those screening days through the school system as well. Just really quick.
That's some great information. Thank you, Patricia. I want to thank you very much for taking your time through your busy. Really appreciate all your
Yeah.
expertise and information you shared with us. It's really great, and I'm excited to share this with everyone else that may not have been able to attend. But yeah, I just want to share that. Thank you again, everyone, and I'll go ahead and stop recording now.